Seasonal affective disorder is a type of depression that occurs with seasonal changes. Typically affects people more in autumn and winter, when the days are shorter and there's less sunlight. People report having low energy, changes in mood, difficulty concentrating, and also difficulty in sleeping. This can also happen in summer months, and it's different from conditions such as winter fatigue, which is more of a generalized feeling of tiredness and lethargy. Seasonal affective disorder is considered a medical condition as it comes under a form of depression. Often, people around you may notice that during some seasons your mood is significantly different. Of course, you may also notice that in yourself, and the best way to know if you've got this is by visiting a healthcare professional and a clinician who can do an assessment to confirm the diagnosis. Once you've reached the diagnosis, there's a lot that we can do to help your symptoms, as well as making certain lifestyle changes to make your body more resilient to the effects of seasonal affective disorder. Seasonal affective disorder has many different treatment options, but these are the three most important things that you should do if this is something that you're suffering from. Number one, making sure that your sleep pattern is regular and you follow proper sleep hygiene rules. Number two, exercising regularly will really help to regulate your energy levels throughout the day. And number three, making sure that you've got healthy diet and proper nutrition so you have sustained amount of energy throughout the day and that you feel healthy and lighter. Finally, beyond this, there are other additional and somewhat innovative ways that you can help support your symptoms. Now, we know that light has an impact throughout the season changes. So using certain light lamps that are available at health shops can mimic sunlight and dawn. Also, when you wake up in the morning, opening your curtain, getting natural light, that is really important as well. Making sure that you're utilizing your screens at the right times of the day and avoiding caffeine very late at night or even alcohol, which may disturb your sleep and also circadian rhythm. Supplements such as vitamin D can help to also support your immune system and regulate your mood. Finally, going to your GP, you may be supported with certain medications. We know that extended release bupropion has been studied for its benefits within seasonal affective disorder, and certain antidepressants such as SSRIs may also be used for this condition. When looking into medication, it's best to consult a healthcare professional for this. So in summary, as we approach the winter and autumn months, these are the most important things that you can do to help with seasonal affective disorder. Number one, make certain lifestyle changes. Number two, consider supplementation with vitamin D. Number three, light therapies. Number four, talking therapies, and also structured social activities can be really helpful. And finally, if these don't help, do consider visiting your GP, and medication may be an option.